Time now for this week's Health Matters. Paul Critz with you. PA Lynn Szabo in the Fug House on a Sunday when we record these. And what are we discussing today? This isn't the usual, like, dire...
Yeah, this is kind of by popular request.
Ooh,
There's
okay.
an interest for discussion of weight loss drugs. Because obesity, a huge problem in Del Norte County, also all over the United States. So I thought I'd talk a little bit about that because it's not as easy as you'd think.
I guess I didn't think it was easy at all. I always assumed, like, weight loss and drugs, that's just...
Right, you remember the fen-phen thing?
Oh, yeah.
Yeah, phentermine and Fastin, I think.
They all seem like dangerous and bad for you.
Yeah, I was actually prescribing that, although I didn't take it personally.
Oh, wow.
And I would say out of the 40 people or so that I had on it, it was pretty much a failure for everybody and actually dangerous for some.
Well, it's not like it's not, I guess, the reality of medical weight loss is that it's just a tool. It's something you use in conjunction with other stuff, right? You're not just going to sit around, take a pill and lose weight.
Right, but it's so hard to live that.
Yeah, that's true.
So, bringing us to the first disclaimer, okay? There is no way to use these meds without a super rigorous commitment to diet and exercise. There really isn't.
I guess, okay, I see. We'll get into the meds later on. I just wasn't aware. Now, are we talking prescription or over-the-counter or both?
Prescription, and there's a sentence or two at the end about over-the-counter.
Okay, good.
So what you really need is a clear set of goals and a timeline. And I learned this about fen-phen is people would come in and say, oh, I just want something to kickstart me, and I'll do the diet and exercise, but I just want, a little bit of momentum going forward. And then so after I go, okay, 2 weeks it is. And, we'll check back in, see how your blood pressure is, make sure, these are actually safe for you and see how you're doing as far as your readiness to start the actual hard work. And that can just kept getting kicked down the road until people were like 2 or 3 months into it.
Now, with some of these drugs, can you actually take them for a couple of weeks without changing diet and exercise and experience?
Well, everybody does, but nobody should. That's the whole point.
Gotcha. Okay.
Yeah.
Okay.
Yeah. So and we should understand, too, that the clinical significance of weight loss here is about 5%. So for a 200-pound person, that's 10 pounds. And everybody is hoping that they're going to lose like 75
pounds.
Yeah.
Oh, wow. Okay.
The dream is, dreaming big, but the reality is a little bit underwhelming. So the rate is about 1 pound a week. Okay.
That's what I've read. That's a safe, sustainable weight loss rate, right? Yeah.
Right. And then it's a constant balance between benefit of the weight loss and adverse effects of the drugs. So they're not super safe, and some of them are terrifying. So bringing us to the first set of terrifying drugs.
Now, when you talk about using these, I'm sorry to jump in like this, but this is what I do in this show. Yeah. When you talk about...
Okay.
So what would be the reasoning behind prescribing these drugs? If you're morbidly obese? I mean, it just seems like if you're wanting to lose... We kind
of go into that later, but greater than a body mass index of greater than 30.
Okay. But I guess, well, so why prescribe drugs like this in addition to exercise and diet? Why not just go exercise and diet? What conditions lend themselves? Oh, not only do you just need to change what you eat and how often you move, but also you need this prescription drug.
Well, say somebody has bad knees, and so moving is like super hard for them. And if they lost 10 pounds, that might make their knee function a lot better.
No, good point. Yeah, no, I get that. Yeah,
so it's kind of to facilitate success, because it's as hard as we all know it is. Anyway. The next one is a group of medications that are injectable, and they come from actually use on diabetics. And so I'm going to slaughter this name because these are all generic, but liraglutide and semaglutide. And they're injectable. Initially is for diabetics. Helps with weight, but also lowers sugar so that the help with diabetic effect and helps with heart health, but has huge black box warnings.
What's that mean, black box warnings?
Black box warnings are FDA information that any prescriber needs to know about the drug because it's super potential badness.
Wow. Okay.
And so if you are a prescriber or if you are a patient thinking of taking these drugs, then it makes sense that you go into it knowing the risks and the benefits. And so black box warnings are the like super urgent, have to know about risks.
Wow.
Okay. And in this case, it's medullary thyroid cancer.
Ooh.
Which is a huge, but that'll make you lose weight, but not the way you intended.
Oh my God.
Okay. And then there's minor side effects like nausea and vomiting mostly. And insurance companies don't want to pay for it because it's expensive.
Okay.
But it's super convenient. Imagine if you could take a little subcutaneous shot once a week or maybe once a day, depending on which med you're taking. And then all of a sudden you're not really hungry and you start losing weight. It seems like that's really tempting for people that are having a hard time losing weight.
I guess.
Yeah. But there's, what if they're diabetics or what if they're, they have heart disease or their knees hurt, and they've tried diet and exercise, but maybe not in a realistic way or for a long enough period of time, then these drugs can be kind of a panacea. But I'm here to tell you they're not all helpful, really.
Well, yeah, no. It sounds like it's a real...
That's a big risk.
Yeah. Yeah.
Now, if I was diabetic and that was the only medicine that kept my sugars down and I didn't have a family history of medullary thyroid cancer, and I agreed with my provider's plan to monitor it and make sure it was doing okay, and I knew the signs and symptoms of concern and all that, then I might feel comfortable doing that because the weight loss thing or the pros and cons of it are different. They tilt it in a different direction. But if you're just a random person who's relatively healthy, that might not go in your favor, really.
Right, yeah.
Yeah.
Wow. Okay.
And then our old friend phentermine. Now, this isn't a combo drug with topiramate, which is actually a mental health drug oftentimes given for bipolar disorder.
Okay. And
so it was repackaged in a combo drug. Not a good choice for people with heart disease because that's kind of like speedlet, It makes people,
yeah. Right? I mean, that's...
yeah, it really revs up your idol there. Okay.
I love that. I'm gonna
right.
go see my PCP.
It has lots
something
of
to
side
rev
effects.
up my idol, doc.
Right. Has lots of side effects, most of them cardio, but also everybody's favorite, kidney stones.
Oh my God.
It's a side effect of topiramate.
So do you know that the topiramate, is it I mean, is it included because it had some other follow along
Yes,
benefit?
because it was noted in people who were using it to treat their bipolar that they were losing weight. Right. In fact, it sometimes becomes a problem.
Oh, the weight loss?
That if it works really, really well to help the bipolar and you can't keep weight on somebody, that makes it not as useful a drug.
Wow. Okay.
Okay. And it's definitely for not for people who could become pregnant because, teratogenicity, which is the word that means, an entity that causes birth defects in the first trimester.
Oh, wow. What's the word again?
Teratogenicity.
Teratogen?
So it is a teratogen.
Okay.
Okay, is that easier? So
teratogen.
Yeah.
Okay.
So up to topiramate is not insignificant. So for women that are on it, if they're if they're of reproductive potential, then they have to take pregnancy tests at the beginning before they start the drug, and then monthly, which means probably a monthly in-person in-clinic evaluations. So
just to make sure it's that bad. The risk is that high. Wow.
If somebody, usually those people are on super duper forms of highly effective birth control, but it is, obviously it's happened before that there's been somebody who's gotten pregnant and there's been problems.
Wow. Okay.
Yeah. Especially in the times of no access to reproductive justice. So the next one is I have never had anybody on this medicine for more than like a week. And so this is orlistat. So this is a pretty safe medicine, but what it does is it causes anytime that you eat fat in the diet, it causes a malabsorption syndrome in the intestines, and then you have this incredible diarrhea problem, and it's to the point where it's incontinence of stool.
Oh, wow.
Yeah.
Wow.
So I don't know I think they set it up just to make the malabsorption so you couldn't really absorb the calories from food, but there's a certain humiliation that makes people afraid to eat.
Right. Yeah, I don't want to eat.
So I mean, it might work that way too.
When they started putting out, I can't remember what the name of the product is, but the fake fat. I mean, that was maybe, I don't know, 10 years ago. I don't know how long.
Yeah.
But that was a side effect. You could soil yourself here because you're not going to. Yeah. So same thing, right?
Right.
Okay.
Right. Plus, you have a lot of stomach gurgles, and you have a lot of cramping, and you have a lot of squirming in your seat, wishing, somebody would stop talking so you could run to the bathroom, stuff like that. So, not at all very helpful. This drug in particular had a therapeutic benefit back in the early days of HIV, where we gave it to people that had certain parasites.
Which?
Orlistat.
Okay.
And it was marketed under a different name then. And it was also intolerable then, but those people were probably more desperate.
Wow.
So it's been around for a long time, and it has a lot of documented safety, which is good, but super hard to tolerate. So 2 old names here that have been combined in a drug again, bupropion and naltrexone. So that's Wellbutrin.
Okay.
A really common drug used in Del Norte for depression and smoking cessation. And also naltrexone for use in drug overdose is the most common thing, but I've been using it actually with some success in alcohol recovery.
Really?
So super helpful. But this is a combination drug, probably expensive because, it's a new formulation, and whatever company is putting it out has a patent on it. Lots of side effects. Again, these drugs were given to people for other reasons, and it was noted that they lost weight. They lost weight. So bupropion especially makes people mean and kind of jacked up and short-tempered.
Wow.
Yeah. Because it's kind of an activator of dopamine, but not in a good way.
Whoa.
Yeah. And naltrexone, I think, is fairly well tolerated, but bupropion, which is AKA Wellbutrin, can cause a lot of side effects with increased blood pressure and seizure. So it has a cardiovascular effect. And seizures, I remember when Wellbutrin first came out, we were counseled not to use it in anybody coming off alcohol because their seizure potential is lowered, or also anybody who had a seizure disorder. So I don't think that we're as cautious about it now as we used to be, but that's still a possibility.
Wow. I mean, it's interesting to me. So many of these drugs are drugs that, the weight loss functionality seems to be almost accidental and discovered, and so it seems like then
But think about it from a big pharma point of view.
Oh yeah, you've got a whole other drug you didn't have to pay to develop.
And you can you can tweak it a little bit, put a little frosting on the cupcake, and then sell it, as not a generic drug, but a newly branded drug.
And you don't have any R&D to pay for. You don't have to go through any of that. Yeah.
No.
Wow.
So I think you'll start seeing a lot of these actually.
It seems like the challenge then becomes managing the original functions of the medicine and trying to heighten. Okay, well, you're losing weight, but it was designed to do these other things, and we're trying to make sure it doesn't.
Like, what if somebody is on chronic opioids for their chronic knee pain because they're 300 pounds, and this would not be a choice for them because of the naltrexone?
Yeah, and then all of a sudden you're in a lot of pain, right? Right.
Yeah.
Wow.
So, but also the clever provider could prescribe these in separate entities. So instead of one pill, then they'd be actually prescribing two. So that's how you get around the money thing. But going back to who should get these. So people with a body mass index over 30, like anybody with a body mass. So that's a lot of people in Del Norte. And I don't think it gets discussed actually in the exam room very often.
What body mass? BMI?
Yeah, it's shrieking at us. It's highlighted in red on the computer chart when we're you know, if we follow the computer in the room, I don't really do that, but you know, there's been a lot of talk on Facebook actually about women who felt like their normal weight, not very sympathetic provider was harping on body mass index to the extent that they weren't really getting the health care that they thought they needed. And I found that kind of an interesting thread, because since the Affordable Care Act has such an emphasis on prevention and discussing obesity as a healthcare problem is important to preventing lots of different diseases, how is the provider supposed to address it in the room respectfully, but also to get the patient to get over anger about it and defensiveness and not, you know, and be able to hear the message without hearing shame.
Well,
So that's a huge, big problem.
And the fact, I mean, if you're talking about, well, first off, the health care that you think you deserve, well, that's the reason you went to a doctor, is so that you can get an actual professional to chime in on it. And if that professional is spending a lot of time talking about your weight, that's a foundational like health concern right there. There are a lot of things that are served well with a person losing weight. You know,
what if it's really a thing? But so how does the provider present that without sounding like a jerk?
Right.
You know?
Right.
So it's been a little helpful for me because, you know, I've been on my own weight loss journey for the last 20 years, but I've lost about 110 pounds in 20 years. So
wow.
Using none of these drugs, I would say diet and exercise.
Right.
Who knew? But I think as a provider, I can bring the message up, especially to women, a little bit more delicately, because I know how I would want somebody to talk to me.
Right.
So, although I'll tell you, when a nurse hurt my feelings, that's when I got serious. So can you channel that potential shame into action and try not to see it as a wounding thing, but in maybe weirdly an inspiration.
Sure. Kicking a butt.
Yeah. So it's really hard though for, you know, a young fit provider, usually male, to go in there and try and bring this up and not really understand all the feelings that are associated with it, and then just like, you know, make it so that person never wants to go back to him. But
when I was a teenager, I've always been a big guy, tall and big, and much heavier as a teen. And I remember being in with a doctor, and it was a male doctor, and a doctor I was familiar with. This was back in the day when it was a small town and you knew your doctor, and you know, it wasn't the first time you'd ever seen this person. Just to check up at some point, like 16 or something like that. And he said, so, and he just looked at my weight and he just said, so you think you could lose some of that weight? And I went, yeah. And that was it.
Yeah, that's a guy conversation.
That's the guy conversation.
That is a total guy conversation. And then they go out and do it.
Yeah, exactly. Yeah. And that's what I did. I went out and did it, but it was
Yeah, but I don't think the women have, I don't know if it's like a hormonal thing or something, or they're just more emotional, or it's caught up in societal judgment.
Well, certainly if you've got a cross-gender thing happening in the room too, that adds a whole bunch to it as well, as opposed to just being like a couple of guys talking or a couple of women talking. Yeah. So I'm interested in, and you said you lost over 20 years now. You are 110 pounds lighter than you were 20 years ago, right? I did kind of the same thing in after that talk, and what it was I got to the age where I'd had a girlfriend in high school, and then we weren't together after high school, and I realized that if I ever wanted to be with a girl again, I was going to have to lose some weight. That was for a 19-year-old male
motivator.
That's a big motivator.
Yeah.
So it was about a year and a half, 80 pounds is what I dropped.
That's awesome.
Not a drug at all. So I look at these things, and you've kind of helped me to see beyond this. I look at these as unnecessary medical crutches, another way for consumer medicals to get into your wallet, to build your dependency on the whole system. I look at this as a failure, having to resort to and that's my own stuff. I understand that. I'm not saying that's the way it is. So you describing to me a situation where like, okay, well, what if you're really heavy and you've got lots of pain in your knees and you need that first 10 pounds off so that you could move better? Okay, I can kind of see that. But there's a part, I just shy away from this kind of stuff. And you said you didn't, there was no pharmaceutical, help for you as well with the 110
Not
pounds.
at all.
It was just moving and not eating the same, right?
Right, basically.
Yeah.
So what I did, and I kind of started slowly too, although I don't want to get into the whole drama of it, but I picked like 3 things that were really straightforward, clear, and easy to do. So I didn't change my entire life. I didn't go macrobiotic overnight. I didn't do anything like that. But I have affinity for donuts. I had an affinity for soda. And I had a dislike of exercise.
Okay, those are 3 key things could be changed. Yeah.
So I stopped eating donuts. I stopped drinking soda, any soda. So diet soda is just as bad, really. And the universe presented me with a slightly hyperactive Chihuahua mix who likes to hike.
Nice. That's
so
good.
Yeah, so it's really, really hard for me to look in his big eyes and say,
no, I'm going to stay home and eat this donut.
Yeah, my knees hurt. I'm going to stay home and have some soda and a donut because, his brain explodes and he's really sad. And that's the high point of his day and he makes it super known. So those 3 things were super easy. And then I had success and then I built on it.
Yeah.
So,
Once that gets rolling, it's easier and easier.
And I'll just say to the sore need among us that we have a great pool.
Yeah.
We have a great pool, and water walking or water exercise or just hanging out in the pool.
I thought you meant pool in the community, there was enough of you could band together.
It's kind of the same thing. So, I have had a group of women from work go water walking, and we're like, and then he said this, and I couldn't believe it.
With the elbows up tight and kind of going across back and forth.
And it doesn't feel like exercise. It feels like, running social commentary with a bunch of friends. So,
but it's a lot of fun, and there are a lot of people. There are a lot of people who take that.
Pool is a gym, and we have it here, and it is more accessible. If you're on partnership, there might be money. To
help with all of
And
good.
You know what I found out on Friday nights? They have an exercise free swim kind of thing, and from 7 to 8, which is a weird time, but it's almost always not. They don't have enough people to make it a go.
Oh, wow.
And so they close. And I'm like, let's change that, Delnor.
So is it something is it scheduled and then day of, if they don't have people show up, they close? So we could just show up that night.
You need 5 people.
Okay.
That's a super low bar.
Yeah. No, I'd totally be down for that.
Yeah.
Oh, wow.
Yeah.
I've thought
don't worry what you look like in a bathing suit, because once you're in the water, everybody's just
head and shoulders.
Armpits up. So,
yeah, exactly.
Yeah, not a problem. So.
Oh, good. Let's do that. Let's keep the pool. Keep the pool alive. So that's how necessary then, and I know you'll say that for the one person who really needs medication like this, it's incredibly necessary, but how necessary is this for just the ordinary person to lose weight? These are meant to sort of address extraordinary circumstances, aren't they?
Yeah, but most people believe they have extraordinary circumstances. But, the weird thing is that this is supposed to be done after 3 to 6 months of intensive diet and exercise changing, and that almost never happens.
Yeah.
So I would say that would include maybe a personal trainer or a gym membership, or a couple sessions with a nutritionalist. These are all available resources in the community, and they're virtually never used.
Wow.
And I know UIHS, most of these resources are located in Humboldt County, and they're kind of unknown to the Delnor patients. So it's up to providers to make people more aware. Do
you have any insight as far as the accessibility? I mean, is it something that you could telemedicine, or is that you will actually have to go down? Yeah, you could totally,
or do a phone, or even just do something as lame as going down to the dollar store and getting a $1 composition book and keeping a food journal. Yeah. So people who food journal actually are more successful in their weight loss efforts.
I have heard that as well. Yeah. Just that consciousness. That purposefulness just changes everything.
And then you have to be in it for your life.
Yeah. You're not going to do this and change things and go back to the way you're like. No, this is an ongoing change.
It's not like you can lose 40 pounds for your wedding in 3 months so that you can fit in your dress and then go for it.
I have gotten into being older and bigger. Although I wouldn't call myself fat, I'm still big. And I have knees, and knees that have been with me my entire life, and realized that being a tall man, that basically I'd learned to walk and to move incorrectly.
Right.
You know, bending at the back instead of the hips, things like that. And it's over time I've spent the last couple of years trying to change musculature, and address those so that I don't have that chronically sore back. And it's mostly worked, actually. There's been a lot of things, but it's not a drug. It's not even walking every day. And that seems to be more important than the distance, more important than the intensity. Right. It's just every day.
Right.
And I started doing it. I weighed myself at the outset, and then walked like 4+ miles every day for 3 weeks, and weighed myself again, and nothing had changed. Right. And then 2 weeks later, I had started losing weight. So this was something that maybe...
None of this is fast.
Well, none of this is fast, but then also as you get older, it gets slower, right?
Probably.
I was thinking about, did it take, the difference between engaging and changing like base metabolic rate when you're 19 as opposed to when you're 55.
Oh, yeah,
There's
totally.
gotta,
If I had known then what I know now.
Yeah, exactly, exactly.
Totally.
So just have patience, even if it's a little thing, but you're doing it every day.
You have to see this as a life change.
Yeah.
What I found with my own weight loss thing is I would lose like 0 for 5 years, and then all of a sudden I lost 40 pounds, and then I would lose 0. For a while. And recently I'm on the good end of a recent like 40-pound weight loss. But when you lose weight unexpectedly in this county too, then people start looking at you.
Yeah.
Like, what's up with you, dude?
Yeah. What have you been doing?
I don't know. I do yoga, but so, and then you have to mix it up like every so often. So you have to add this or not do this or do more of this or,
I plateau and I get bored and I get, it's nice to mix it up. So you said that toward the end, we've got about 3 or 4 minutes left, that you had something about the over-the-counter stuff.
Yeah, and that's quick. The dietary supplements are mostly ineffectual and some are super dangerous.
Right.
So, I was surprised at actually how much there was over the counter when I was researching this. And I don't want to draw any attention to any particular thing, but they don't really work.
And they don't need to be regulated at all, too, as supplements.
They're not regulated. There's certainly a good chance that what you think you're putting into your body is not, or there's some other hitchhiker along, some other drug or toxin.
As happened, I heard in a case involving supplements from a big, huge, perhaps one of the world's largest retailers, just ground up houseplants.
Right. Right. So you're not really getting what you think you're getting, and you might be getting something that you didn't expect that's dangerous, and it's not going to help you anyway in the long run. So don't even do it. I find it interesting how many people think that the nice lady at the vitamin store knows more than their doctor.
Right. Yeah. So, like a more practical, it's almost like a more practical, like village, like folk medicine kind of thing, right? Yeah. Oh, well, the good old days of Dexatrim are over.
Yeah, don't do it. But I do want to say something that would help a lot, not really for weight loss, but for living in Del Norte at this moment, having seen like huge numbers of people who are sick, actually more with influenza, but there's a good healthy COVID.
Happening really?
Kind of going around, and RSV for the little kids and the elders, is that I have not seen anybody yet who got the flu and had gotten a flu shot. I just want to throw that out there.
Wow. And this is in light of what we talked about last week, where you were talking maybe about a 30% efficacy rate this year for the flu vaccine.
Right.
But it's mostly...
My data are different, I would say. So I just, we saw people in the acute care clinic. We saw a lot of people with influenza A yesterday. Not a single one of those was immunized.
Wow. Okay.
So if you don't want to get, and then the other thing is if you don't immunize and you get the flu, then you lose waning rights. Then your provider is over you.
Yeah.
Okay.
Talk to the man.
Because the best thing we can do is give you some coughs, some Tessalon pearls for cough suppressant, and then say give you a flu shot. Get a flu shot next year. But if you say that to somebody, they glare at you. So.
You will not get. You cannot do your dying swan routine.
That not only comes from me, but one of the local ER physicians was expressing frustration because this is exhausting for you guys, for the sick people as well as the people taking care of them. Mm-hmm. Is that all we can say to you really is get a flu shot next year and do it. Just do it.
Just do it. Come on.
Yeah, come on, you guys. And if you update your COVID booster to the new bivalent one, that would be smart too. And you could get them both on the same day.
I feel so good. This is the first time in a long time that I've gotten a flu vaccine. A lot of times I'll just forget.
I know. I've heard that too.
And I've gone like, and I'll turn around and it's March. Okay, well, it's done.
I still do it.
Yeah, I know, but why? I made it that far. And so that's what's going. I've obviously won, Lynn.
No, you've lost your whining rights. There will be no whining.
And so that's just it. I better not get sick this year because I'm all vaccinated up now.
Right. Well, I haven't seen anybody who's vaccinated properly who's sick.
Who's sick. Okay, good. Okay. Later on today, and we should wrap up. We're out of time. But later on today, I'm going to a public function that is, and I think this is a good way to leave it. I'm going to go see one of the Redwood Voice kids in Rent up in Brookings to the Checo Pelican Players.
Cool.
Mask?
Yeah.
Should I mask?
I would.
Okay. Because here we are. We're right in the midst of it. You'll be the
only one in the room, but I would.
At least I'll mask with me. So we'll have each other to mask with. But yeah, because that's where we are. Let's not forget, pandemic never ended. It's still out there, and now it's got pile on with RSV and influenza and all of that. Okay. All right. So masking still smart.
Yeah.
Okay.
Super smart.
Anything else?
No, still trying to get Mike in here to talk about the nature of pharmacies in rural communities.
One of these days.
But you know what? He was at work till 11 o'clock last night.
And that was hours beyond when he was
supposed to. So I think he might have a lot to say.
Okay, well, hopefully we can get him in one of the shows ahead, and then I guess we will be recording something this week at some time Friday. I guess we said we'll have a Christmas
holiday recording hours.
We'll have a Christmas special. Is that what we'll do? What can we do for a Christmas special? Health Matters.
I don't know.
We'll think about that. It. Okay. It's a very special Health Matters, a holiday Health Matters next week.
Santa's healthy lifestyle changes. His body mass index is over 30.
Those chimneys aren't getting any bigger. All right. Thank you, Lynn Szabo, PA. Thank you very much for this week's Health Matters.
Thanks.